Solution Talk. Multi-stakeholder partnerships as a catalyst of North-South innovation. Please welcome to the stage Ismahane Elouafi from the Consultative Group on International Agricultural Research.
Good afternoon, colleagues. Good afternoon, colleagues, and welcome to this session on multi-stakeholder partnerships as catalyst for South-North innovation. I want to begin by thanking the co-conveners, Amref Health Africa and the Gate Foundation, for bringing this conversation to Hamburg Sustainability Conference. Join me today. With me, I have 4 panelists who bring perspective from across the partnership spectrum. We have with us His Excellency Dr. Ahmadou Lamin Samateh, Minister of Health of Gambia. We have with us Laviolette, Head of Secretariat at the Global Financial Facility. We have with us Caroline Mbindyo, Chief Innovation Officer at Amref Health Africa, and Dr. Claus Runge, Chief Health Equity Officer at Bayer. Multi-stakeholder partnerships drive innovation. It drives that innovation to scale. It brings together government, researchers, private sector, and civil society around problems that no single actor can solve alone. That matters especially now, when the multilateral system is under pressure and the space for traditional bilateral cooperation is narrowing day by day. The partnerships are essential across every major global challenge, from climate to food security, to malnutrition to health. And those challenges intersect. At CGIAR, our research on nutrition and food system carried out in partnership with government, with communities, with private sector across the global south, and in collaboration with the global north, feeds directly into health outcome, including maternal and child survival. That connection is why this conversation matters to us and why I'm looking forward to the discussion ahead with our panelists. I would like to start with a question, and I would like you really to be very concrete. Name a concrete multi-stakeholder partnership you and your institution are involved in, and give us really the juice of it. Who was there? How did it work? What didn't work? What would you do differently? And maybe I'll start with you, Excellency Ahmadou, to give us the perspective from your seat as Minister of Health in Gambia.
Thank you very much, Ismahane, and we thank the organizers for giving us this opportunity to have a discourse on the multi-stakeholder partnership, which is very, very critical. Quite a lot of interventions fail, especially in the health sector, when all the parties who are responsible are not at the table. Too often than not, we come together and think for people, either from the partner side or from the government side, without involving the communities. So communities are very, very important because a lot of interventions are geared towards them. So sitting with the communities, knowing what their priorities are. For example, we might think that that community needs a health facility today, but there is a health facility that's not too far away. Maybe today it's water they need, and by finding out from them what their current needs are, because the needs list is a whole lot, but what matters to them, what will make a life-changing intervention for them is very important. At the government level, of course, naturally, I'm going to talk more about the health sector. When the COVID-19 pandemic struck, the Gambia, as many other countries, did not have an emergency treatment center. We had a lot of partners in country. We have the World Bank, we have the UNDP, we had WHO, and the government of the Gambia, of course, now, and the Social Security and Housing Finance Corporation. And we said, let's come together. Let us see what we can do to ensure that the country gets a befitting emergency treatment center. Some of the people brought on board the technical expertise. others brought on board the resources, and the designs were made, and then we, at the end of the day, were able to get an emergency treatment center. The same we did. Many of the countries during the COVID pandemic, we didn't have oxygen systems. We depended on commercially sold oxygen, which was not even specific for the health sector. But having on board the same partners, we were able to get the first oxygen plant for the Gambia that was life-saving. So these are some of the examples. You said one, but there are many. But I'll come to one that we have currently with the German government, with the KfW. Now, KfW during the COVID pandemic again came on board and wanted to support African countries. And then what we said to them, so the German development minister that time came to the Gambia. I had a meeting with him. And by the way, I thank him very much because that was not the time to travel anywhere, but he was bold enough to come to Gambia to support us. Now, that was very good. And then we said to them, yes, we want intervention, but we don't want things that will come and disappear after 3-4 years. We want things, infrastructure, equipment that will stay for 50 years thereabout. So now, just to sum it up, now we are establishing a multi-purpose treatment, multi-purpose surgical operation center for cardiothoracic surgery and for kidney transplantation, in collaboration with West African Health Organization, KfW, and the government of the Gambia. Thank you.
Thank you very much, Minister Ahmadou. And thank you. You showed us both a national multi-stakeholder example, but also a bilateral and international with Germany. And thank you also for showing that its health is related to water and maybe other areas as well. So I'm going to move to you, Caroline. Which example you want to bring forward?
So thank you. I work with Amref Health Africa, and Amref Health Africa is the largest African public health nonprofit in Africa. We focus very much on primary health care and social determinants of health. And when we talk about primary health care, we're talking about how do we do disease prevention, health promotion, early diagnosis, linkage to care. Because when you think about investments in health, primary health care is one of the best investments. And why do I say that? Because if you look at, let's say, the European Union, the per capita expenditure in health is about $3,000 on average. In Germany, I think it's about 5,000. In Africa, sub-Saharan Africa, it's 80 euro equivalent. So it means that although there are many reasons to remain healthy, one of them is because you cannot afford to be sick.
Yeah.
And this partnership that I'm going to talk about is around how do we ensure that communities remain healthy by using community health workers. The partnership is a group of nonprofits who are traditionally competitors, at least where funding is concerned. But this group of nonprofits who have been working in the primary healthcare and specifically community health came together based on a request from our government, the government of Kenya. And they wanted to professionalize community health workers so that they can be able to provide quality services at that level. So this group came together and we developed a joint plan. And what we did was, number one, we lobbied with political parties so that they can include community health, professionalization of community health in their manifesto. We started this work in 2019. We were having an elections in 2022. When the new government came in 2022, they then started funding community health because it was part of their manifesto.
Yeah.
We then looked at how do we lobby for the bills that we need for community health to become professionalized. And these were specifically for looking at primary health care, looking at digital health, looking at social insurance, and that was then passed in 2023. We built a digital platform jointly and deployed it across the country. I think Kenya is one of the only countries globally, I think just a handful, who have a completely digitized community health, where community health workers who go door to door and serve millions of households every single month are able to provide services, are able to collect data from those households, so that when you think about decision making at the primary healthcare level, at the subnational level, at the government level, they're actually using community data to inform what decisions they should make, what investment they should make, what are the health challenges that are being experienced in that community. So this is the power of partnership, to be able to change something, to be able to get it institutionalized and adapted by governments so that it now can be able to serve the people of Kenya.
Thank you very much, Caroline. And I hope really that breakthrough in Kenya could be mirrored in so many countries. Definitely, very early interventions are very important. It happens in all areas, and definitely for maternal and child survival. I want to just draw your attention as well to the concept of the 1,000 first days in terms of nutrition and how important to have those micronutrients for the pregnant woman and the kids. So this is another area where really intersection is very clear between nutrition, agriculture, health, and the early intervention. It's a saving for everybody, including taxpayers.
Yeah.
So with that, I'm gonna move to you, Luke, and would like you to hear your example.
Thank you very much. And it's nice to come in right after the Honorable Minister and Caroline, because actually the model that I'll talk about, the Global Financing Facility, very much is country-driven and draws a lot from civil society as well as the private sector. So it's the Global Financing Facility for Women, Children, and Adolescents. It's based at the World Bank. And the mission is to eliminate preventable deaths in women, children, and adolescents. So it's quite an ambitious goal. It was created at the start of the SDGs 11 years ago, and I understand Chancellor Merkel had quite a role to play in pushing for this. And it was in recognition that the world just wasn't moving fast enough on that objective of eliminating these preventable deaths, and that a new financing model specifically is what was needed. So key elements: country in the lead, so truly in the lead. There's 36 of the highest burden countries that are members of the partnership now, and we have an objective of reaching 50. And this is anchored in a prioritized national plan that is ambitious, because that's what you need to be able to reach the objective that we have, but also realistic. So it's a highly prioritized plan that's based on available and foreseeable resources. So there's a financial element there, and then aligning the stakeholders around that plan by developing it jointly and also then implementing it jointly. There's a national platform that helps facilitate that. And one of the big changes we've seen is a much greater voice where it was missing for civil society in this whole process. I think most importantly is that the plan is always financed. Yeah. And that's the financing part here that's critical. So starting with domestic resources and advocating and even incentivizing greater allocation of domestic resources. And then the GFF as a trust fund that has been generously funded. We have $3.3 billion to date from 16 donors, including Germany and Gates, who are in the room. And those grant funds are matched with the World Bank funding that then funds a project that becomes sort of often like the lighthouse for reforms in a country, right? And then we aligned external funding around that plan and that project. That has generated to date $11 billion of additional World Bank funding for women, children, adolescent health. These funds are always on budget, they're always managed by the governments, and they're always implemented through the systems. And so that's an important element of sustainability. The whole point is to reach scale. So what has been achieved? Hundreds of millions of additional women, children, and adolescents having services that they need. And most excitingly, from my perspective, is these 36 countries that I mentioned, at the start of the SDGs, they were negative outliers in terms of their mortality rate reduction. They've all become positive outliers. And some of these are the toughest places in the world to work: Somalia, Sierra Leone, etc. And quite an impressive switch. But also scaling of innovations and just much more rapid progress.
Thank you so much. And thank you. Really, it adds to the example of Caroline and Minister Ahmadou, particularly under the World Bank group. And the co-leverage is amazing. 3.3 billion, 11 billion towards the same goal. Thank you. And it's country-led. So this was quite an important example. We're going to move to the private sector and to Claus to hear another example.
Yeah, thank you for the question. And as Bayer, as a representative of the private sector, we we also have our sustainability agenda clearly defined as a company. And for the pharmaceuticals division that I'm working in, we committed back in 2019 in Nairobi at a population conference to making 100 million, to granting 100 million women in the LMICs access to modern contraception. So the current gap is roughly 250 million women don't have access to it. And it means that they cannot fully thrive and live up to their potential, because oftentimes we have unintended teenage pregnancies, early marriage, etc., etc. So we said as a world leader in contraception, we want to do this commitment by 2030, and it means 100 million women served in 2030. It's not a cumulative goal, so it means 365 days times 100 million units of contraception or protection provided. And this is a journey of partners. As a single company, we couldn't get any close to this. Last year we reached 68 million women, which shows that we've really lived up to our commitment. And if you think about the whole journey that we're on, it's really coined by these crucial partnerships that give us access and scale in particular. So on the one hand, we have built an additional factory in Costa Rica to make sure we have sufficient supply on stock. But we've also started to empower local or national governments to have the production in their countries. So we have 2 tech transfers to Nigeria and Egypt, where we partner with local companies that we now empower to produce contraceptions on their own for the domestic, but also for the regional use. So that's an important partnership to really make the products more accessible. For 50 years now, we're a large partner of ours is the United Nations Population Fund, who acts as a procurement agency. So we have a long-standing partnerships with UNFPA, also when it comes to last mile delivery. So we have direct contracts and discussions with governments, not only on the procurement side, but also when it comes to capacity building. So we want to make sure that the commodities that are being introduced into a certain country are properly used, and that the women ideally understand what the choices are, because ideally a woman should be able to make a choice as to what contraceptives she wants to use. And then finally, when it comes to capacity building and education, we have large-scale partnership also with the Gates Foundation via the Johns Hopkins University. We run a large-scale program that reached roughly 30 million women last year living in informal settlements called the Challenge Initiative. And back to your point, Your Excellency, it's all about wrapping in the local communities and administration into offerings when it comes to family planning, sexual and reproductive health services. And we then need to make sure that with local partners, the women are not only informed, but that they have the proper supply at hand. And that's why we also signed an agreement today with BMZ, GIZ, and the Equity Bank to help us understand what the needs are locally and how we can avoid stockouts. So we are developing AI-based models to make sure the right commodity is available at the right time, at the right place. So it's all about partnerships. I'm hugely grateful because over time, we've probably moved from just being a sheer supplier to really a partner in the ecosystem. And that really, really has evolved over time. And I'm very optimistic that by 2030, we can proudly say with all the partners, we've been able to reach 100 million women in LMICs. So
thank you very much. And the number shows the power of private sector. You're talking about millions and millions. And if I got it right, you want to get 100 million women per year by 2030.
Correct.
So wonderful. With that, we're going to move to Harry Menon, the president of the Global Growth and Opportunity at the Gates Foundation. Over to you, Harry.
Thank you so much, Ismahane, and thanks to all the panelists for your really valuable insights. And Luke, it's good to see you after over a decade. Yeah. We fully believe, in the power of multi-stakeholder partnerships. It's how we've seen some of the biggest transformations over the last couple of decades happen. Just from the Gates Foundation's own work. 2 examples, just to mention. Gavi and Global Fund, both of which have contributed to saving millions of lives and also strengthening systems in many countries across the global south. And if you look at the elements that led to both of these partnerships being successful, the elements are pooled financing, country ownership, technical expertise, and long-term donor commitment. And there are examples from outside health as well. Since you and Bram are here, I'd say the Cereal Systems Initiative in South Asia, which helped cover over 10 million farmers, similar archetypes of partners working together. And then in the context of nutrition, I think the work we're seeing on scaling up large-scale food fortification is another example where the engagement of government, private sector, civil society groups with support from philanthropies such as ourselves is having fairly transformative results, and it's a very cost-effective intervention. And the Gates Foundation, as you're aware, we have 3 goals for 2045. One of which Luke mentioned, the ending preventable maternal and child deaths. The other 2 are eradication of infectious diseases and to help lift hundreds of millions of people out of poverty through access to economic opportunity. And for all of these 3 goals, we feel nutrition is a foundation. And so large-scale food fortification with what that enables is really important. But this only works if the private sector are fully on board. And so a lot of the work that we are now trying to do is engaging with countries, because ultimately countries set policies, regulations, get the private sector on board, so you're able to achieve population level coverage, because the importance of addressing micronutrient deficiencies shows up in how well bodies, healthier bodies, sharper minds, better learning outcomes, and more economically productive lives. And that's something all countries in the global south need. We recognize, of course, that the world is going through a massive transformation, political, economic, social, and the like. And so it's really important that partnerships, especially ones where innovation is at the center. That's what we as a foundation focus on. The biggest risk is that innovations are thrust upon countries, and I think with the shifting dynamics between the global north and the global south, and the global south having a lot more agency to choose and decide for themselves, it's really important that we think of how innovation also gets decided by the people whom it's meant to serve, right? Who sets the agenda? I think it's really important for that shift to happen. And, we are therefore looking at ways to evolve some of these partnerships to the next level. So with your permission, I'd like to pose, 2 questions to the panel, and maybe I'll direct it to His Excellency and you, Carolyn. So what concrete mechanisms do you see as being crucial to ensure, Global South partners genuinely co-own the innovation agenda instead of just being recipients and co-implementing? That's one. And the second is, what can international partnerships and platforms, the ones that may have worked very well in the past, what do they need to do differently to make sure that this kind of Global South ownership gets inbuilt, even as you look at how to maximize the benefits that come from global scale and global expertise?
Thank you very much, Harry. Over to you, Minister.
Yeah, thank you very much. Thank you for your input and for your questions. And I also thank the private sector, Bayer, and then the Gates Foundation and GFF and all the others for really supporting countries in the Global South. They didn't have to. So if they have the goodwill to do so, it's appreciated. And the people, it touches the lives of so many people. So it's highly appreciated by the governments of the Global South and by the ordinary person. But I want us to always reflect. Why do we have the Global South the way it is? What went wrong? What should have happened, it didn't happen? And what shouldn't have happened, and it happened? So that can take us a whole 1 week or 1 month here to discuss. So we don't want to go to that route, but we want to start from here. What can we do better? by the partnerships and to move forward. But I also task each and every one of you here. I know you are all interested in the partnership between the global North and South. That's why you are here, spending the afternoon here. But how much do we know about the global South? Each one of us. So today, probably when we go home, let's Google and find out, how do the streets look like in Gambia? How do the villages look like in Gambia? How do the women and children go to school, health facilities? Do they all have potable water? The drinking water we are seeing in the taps here, in some countries, in some communities in Gambia and many other countries, is luxury. There's no tap in those villages. They go to villages, they go to wells. So the struggles of the government is to get access. If you see some of the roads, and when I talk about the global South, it's the same for most of the countries. Global South itself, there are different levels, but it's the same for most of the countries. Access. How do we get women, pregnant women, to a health facility? Sometimes it's on a donkey cart or on a motorbike, pregnant woman, on a motorbike to go to a health facility to deliver. So as a government, what are we doing? In Gambia, fortunately, our government decided to buy 80 ambulances from our country resources so that woman goes to the health facility in a 4x4 vehicle, air conditioned, which is good. But so there are challenges. The resources are totally different. She mentioned the per capita expenditure on health in Germany being $5,000, in Gambia and many other countries, $80. And the human body happens to be the same in Germany and in Gambia. If a patient has acute appendicitis in Germany, in the UK, and in Gambia, the treatment is the same, appendectomy. And we cannot say because it's Gambia, we will have to use water instead of the antibiotics. We have to use the propofol and then the halothane and then, ampicillin or cloxacillin or flagyl, metronidazole or whatever. The treatment is exactly the same and the resources are limited. So what we are saying is there is a huge disparity. But the Global South is not saying we want to put our burden on other people. I mean, it's not fair. But I think we need to collaborate. Yes, being a recipient, we still need the support. Sometimes I hear colleagues saying the solution is at home, it's in Africa. You see, Ismahane and myself, we have a deal. When she touches her glass, she's reminded me to stop. So I will say it here. But this is very critical.
Take a minute to
This is very critical. You see, we need to be able to do something. So when I hear colleagues in the Global South saying the solution is at home, we need to look inwards, domestic resource mobilization, yes, it is true. Because people cannot be helping people who are not helping themselves. But the truth of the matter is, the same reason why the roads are bad, there's no potable water or electricity, is the same reason why the health facilities are not so good. The same reason why we do not have treatment for cancer. So the resources are limited, so we still need partnerships and so on and so forth. We thank you, Bayer, for the support for contraceptives, but we urge you to do more. To do more in the sense that maybe you need to also talk to people in the Global South. And this is one of the biggest advantages of this partnership meeting, so that we have direct interface. I think sometimes the perceptions are different, and our needs, people do not know what our current needs are. You have 100 needs, but maybe 5 are priorities today. Absolutely. And one of them, for example, my biggest headache as a health minister, I've been health minister for 7 years now, the biggest headache for me is to make available high-quality medicines and medical consumables for our people. Now, Bayer produces medicine. The market is there. We have a huge market in Africa. The population is huge. But the problem is the market price of your products maybe are too high. So why don't you make them reasonable? You will still make a difference, because now you are going to sell to millions and millions. The profit margin will be small. It will be affordable to the people, but you'll still make profit because now you have a bigger market. And then, most importantly, you would have saved the life of that child and that pregnant mother somewhere far away, and that's the essence, really. Thank you very much.
Thank you, Minister, and thank you. It's a reality check. I think it's a reality check. It's knowing the data, working with the local institution and people because they know what's happening. So, Caroline, if you could just address, when does it feel country-led and community-owned? And maybe then we open it for a Q&A.
I want to answer that in the form of a story, a real story of how many projects that are deployed in, a lot of low and middle income countries work. The person who is solving the problem, it could be me at Amref, it could be somebody else, comes, let's say, to a village. And you go to that village and you see they need water. And you go and talk to the elders of the village and you agree we are going to put up a water pump. And you set up the water pump and it's there. And a couple of months you come back to see what is happening. Is anything changing in that village? And you find nothing is happening. So you go and you find the women are still going to the river to collect water. Why are they not using the water source that you put in their village? And then you go and talk to them and ask them what is happening. And they say, oh, the only time that we as women have to talk to each other is when we go to the river to wash our clothes. So when you went to create this solution, you went to talk to the elders. You didn't talk to the people who go to the river to fetch the water.
Yeah.
A lot of the solutions that we build are exactly like that, designed without the understanding of the people who are actually you're solving for. Should you be solving for or solving with?
With.
Should you be understanding what the real problem is so that you can solve the real problem? So I think a lot of development work is built that way. We love our solutions. We don't love our problems. I think if we loved the problem, it doesn't matter what the solution is. You will focus on solving the problem and not rolling out a solution that you believe in.
Thank you very much, Caroline. Very powerful example, sincerely, that stick to mind. Include everybody as you are, identifying the priority and then solving it together. So maybe I'll give you also 1 minute, Luke, and 1 minute, Claus, before we open it to the people.
No, just to emphasize a few points. So the point on there's not enough money is important. So we talk about innovations as a way of creating efficiency, and there are efficiency gains that we can have, but the current levels of funding in health are just not sufficient. So more domestic resources, but also external financing. And maybe a point about who decides. I think that is really important. And what we've seen is, and that's at different levels. So we just heard a really good example at community level, at a policy level. So when a government is deciding what should be a priority, if they put domestic resources in, there's a process that happens. And I've been in different sort of interactions there where as an NGO in an early stage in my career, we were integrating within government systems, but they weren't financing. And it stopped after we funded in that case. What we focus on now is integrating at the GFF is integrating innovations with domestic financing first and foremost. And we feel that's a tipping point for they're being sustained in the long term.
Thank you very much, Luke. Claus.
Yeah, so two thoughts on what's been said. So first of all, in terms of pricing, I would really like to make clear we price for affordability. So the prices we offer in sub-Saharan Africa are extremely low. Yeah, so we really have a tiered pricing system. So the issue we sometimes have is the same tablet that leaves our factory in Berlin will end up, if you set it at the same price to the wholesaler, will end up at, let's say, €1 per day cost in France. But the same tablet that we sell for the same price into the system will cost €4 in West Africa. So we have a huge issue that the whole, let's say, import tariffs, customs, the whole middleman, the distribution network, they really have super large markups. We could sell it at 1 cent. It would even be more expensive than the prices in Europe that we have. So that's really a fundamental structural issue we face in many markets.
And that's where you are manufacturing is very important.
That's also so. Yeah. But the good news is there are ways to address this. So just a couple of weeks ago, I've been to Rwanda signing a procurement agreement with the Rwanda government. So we now have a vast catalog of our products. We don't limit them to any specific ones. And we make very, very competitive offers for the government of Rwanda, who also seeks to do some pooled procurement for neighboring countries. So there is a way, when you have a direct business to government channel, to really handle the issue that we have. So, and I really want to invite you, let's have a talk. There will be solutions, I'm 100% sure. The second thing is, when it comes to partnerships, the term of competition may sound opposite, but I mean, we see a huge ODA crisis, right? Yeah. We've lost like a quarter last year alone. But now the question is, how do we recalibrate? I think partnerships play a hugely important role, but I think it's also time for a competition about the best partnerships. I firmly believe that competition will also help us solve some of the huge challenges. I don't want to downplay the financial crisis that we have, but born an optimist, 51 years in, I still am. I firmly believe in competition to also help us solve some of the issues.
Thank you very much, Klaus. And definitely competition and collaboration. I think we have to, I heard the ding, so we are 9 minutes. So there's definitely a balance to strike between the two. We're going to take 2-3 questions. Is there any questions? So I have a gentleman here, a gentleman here. Is there a woman? Yes, I didn't see you in the back. Apologies. Okay, so we go you first, ladies first. Yeah, thank you.
Thank you so much. I have an issue when we are looking at partnerships. Normally, we're looking at the current ones. How can you ensure that there is sustainability? Because when governments change, also in the global south, the whole vision changes. So how can you make sure that what you have started is going to continue?
Thank you, Aya. So we're going to collect the questions and come to you, colleagues.
Very closely connected. We've heard about success, about importance of multi-stakeholder partnerships. Do you have an example of a partnership that failed and from which we can learn about the 1 or 2 top issues that we need to be careful about?
Thank you so much. A question?
Well, actually, I want to ask if there is like a forum that we can learn about the lesson learned about regarding multi-stakeholder partnership, because we also my organization, a local organization in Indonesia in Central Kalimantan, it's about community-based restoration. So far, so good, but there's also fail stories there. And I would like to know more, learn about, because it's so dynamic and it can be applied to many, many other sectors. So I think maybe it's an idea, maybe it's a question also. If there is a forum like that, it will be very helpful for us. Thank you.
Thank you. One last question from the gentleman in the back, and then and there is a lady, so it became 5. I hope you can answer them all, yeah?
Yeah, thank you. My question goes to the Bayer representative. Why is it that you are also not decentralizing your production lines to the south? Don't you think that can be an important factor in terms of driving the cost down? Thank you.
Thank you, Maud. Yeah, the lady in the back. Yeah.
Hello, my name is Emma, and from Ghana. To the question about if funding comes into the Global South, how do we make sure that it's sustainable if funding is removed? And I'm thinking with the youth, if you're aware, in Africa, the average age is 18 years. And there has been a lot of youth empowerment when it comes to businesses. I am a product of that. What do you think about investing into these youth and their businesses so that after the funding comes in, of course, there would be feasibility tests. It can then empower that continuous revenue generations, creating the supports that we need locally, but being done by ourselves, so you don't always have to bear the burden. Thank you.
Thank you very much, Yvonne. So we got a question on sustainability as government change. We got a question on failure examples. We got a question on how could we co-learn from different parts of the world. We got a question on manufacturing for Bayer. What about decentralization? And the last one from Yvonne on youth engagement in Africa. So I'm gonna go from this side, pick a question that you wanna answer. We start with you, Claus, and we go right to left.
Answering the gentleman on supply chain. So let me start by saying up until COVID, we had horizontal supply chains. Everything was produced just in time. Everything was there just in time. Now, post-COVID, that came under pressure, and countries, especially, and governments, especially in the area of health, wanted to start verticalization. So everyone wants to be resilient, autonomous, and wants to make sure that the most needed goods are being produced locally. Now, that per se is way more inefficient than the previous system, because everything you invest into verticalization, you miss on investments into innovation, and that's what we need. So, however, we still do verticalization, and as I said earlier, we have started to deploying production of contraceptives into Africa. Now, why are we doing this in 2 specific countries? First of all, we see that there is a market. That's not the case in every country. So, but with this investment and this technology transfer, we see that there is a market, one. And secondly, there is also financing available, for example, from the European Union, that helps us overcome the transfer cost.
So you are thinking of it, and you have few examples, and maybe you take it offline as well. Over to you, Caroline. 1 minute, please.
I feel like I have to say something about manufacturing in Africa.
Yeah.
You've talked about a market, and it's obvious if you think about Egypt and Nigeria, why you think there's a market there. But I think if you look at Africa and the direction that the continent is taking, when you think about things like the free trade agreement and the intention to create one market across the continent, I think if you look at what is happening now versus what the potential is, you will find that Africa is indeed a good market for local manufacturing, and I think it's something worth considering. Absolutely. I also I like the question on sustainability and what happens when there is no funding. I think we have heard many times the phrase trade, not aid. And I like that phrase.
Yeah.
But I think it comes with the same challenges that aid has, in that the people who are saying trade, not aid, are looking at trade only from the benefit of one side, but not necessarily the benefit of the other. I think the youth empowerment champion has said it well, that young Africa is rising. They are very interested in developing the continent. They have ideas, and they are not looking for a handout. They are looking for investment. Can we look at that and say, how can young Africa develop Africa? How can we invest in it so that, yes, they can develop the continent, they can develop themselves, but also the investor can get a return on their investment.
And they can save the world and save the Asian population all across the world. Absolutely. Thank you so much, Caroline. Minister.
Thank you very much. Yes, sustainability is very important for any adventure or any venture that we enter. But on the African side, for example, and the global south, involving all stakeholders is one good element of sustainability. Because if people are not involved, then things cannot last. But of course, capacity building is very important, so that when the other partner is not there, because at some point there should be a winning, they should be off the circling, we cannot continue. Then local capacity would have been there. But even if government changes, so in Gambia, for example, what we are doing, we are building systems that are not dependent on the president or the minister, so that even if government changes, those systems are there. Civil society is vibrant, private sector is vibrant. That is very critical. However, government changes can affect any system. That is why we are having the shrinking ODA now. It's because of changes in governments around the world and the change in mindsets and so on and so forth. So I think that is very important to have strong systems. But in Africa, one thing we are also very particular about, and I'm very proud of the new generation of African leaders, because we are dealing with efficiency, transparency, and accountability. You see, too often than not, previously, Africa was thought to be the corrupt place where things don't work and so on and so forth. There might have been some truth in that, but that has changed largely now. Civil society is vibrant, governments are transparent, and we ensure accountability and value for money.
Thank you so much, Mr.
I hope I'll have something to say to him when we wrap up.
Okay.
You've
So over to
generated
you,
a
Luke.
debate. This is
Yes,
good.
exactly. So
I like coming in at the end because then I can be extremely brief. I just want to, because I agree with a lot of what's been said on sustainability. That's what I had wanted to address. The only thing I would add is the power of data. Real-time data to be able to track and produce results and create momentum, but also accountability. I'll leave it at that.
thank you so much, Luke. I think we had a wonderful discussion. I'm sure many people are going to grab you and discuss with you, but really what stays with me is that multi-stakeholder partnership is key, is important. The South-North innovation and pathway is very important. It's two ways, North learning from the South, South learning from the North, and they won't just end up as climate change is accelerating. We are in a very hot week right here in Germany. I just was in London Climate Week. This happened for many decades in the South. They have learned how to adapt. They have some solutions. So I think we need to work together because the challenges are joint challenges. It's not North, it's not only South, it's all of us human beings on this planet. And as a human being, and that's maybe a part of a spirituality from my side, we are responsible for our species on this planet. So we need to protect our environment and we need to care for each other. Thank you so much. Please join me in thanking